need allies. So I qualified in 1991, and the three men behind you, you've got Ahmed Shandal on my side here. Ahmed was my all vascular, Ahmed and Ian were vascular surgeons, and brought me to the conversation that's what I wanted to do for the rest of my life. Kieran Horgan, who is, let me see if I can get the pointer out. This is Kieran Horgan. This is what he used to look like on that side, and behind him is the gentleman that I ended up marrying, who was my registrar when I was a houseman. And Kieran introduced us, and Kieran has been a lifelong mentor, and even now, if I achieve anything, there's a little WhatsApp that goes to him to say, Kieran, thanks. Because he taught me so much of kindness, compassion, mentoring, support, that are vital if you want to ensure that your team succeeds. And remember, your allies don't have to look like you. All right, your allies come from all different influences. They can be outside of work. They can be a person or a neighbour. Just listen to the allies who are there and don't second guess what they're saying to you. So, I started off, Tanvi was saying that revenge is quite interesting and sometimes quite sweet. I became a consultant vascular surgeon in Croydon in 2004, but for the 2 years before, I was told, despite having my master's and working as hard and all the things that I did, that I would not get a job in London. My husband was a surgeon in London, I had 2 children, but absolutely from the vascular seniors, I was not going to get a job in London. Quite interesting. But I got my job, and 10 years on, where I had to then go back and work with the original individuals, I did whistleblow. And the professor of vascular surgery is no longer working in this country and was suspended and taken off the shop floor, and the divisional clinical director now serves coffee. So, sometimes you have to wait, but you need to do the right thing, and you need to stay true to your integrity, true to your beliefs, and make sure that you are supported in the conversations that you have. And there are good people out there who will support you. But I carried on. So this is a little mind map of my educational role. So if you're excited and interested about something, then just get on and do it. So I started off doing training the trainers, got picked up as faculty, became the foundation program director, core surgical training program director, higher surgical training program director, went into the college. I was pulled in as part of the general surgery SAC, which is nationwide, and then chaired the Joint Committee of Surgical Training for the 4 nations. But you have to start off by saying yes when somebody asks you to do the first bit. Because if you do that, people then want to make you, will ask you to do more and more. But the reason I put this up is because you can influence change. So the photo at the top is all the chairs of the Joint Surgical Training Committees for the 4 nations, and I am the only female. I couldn't influence that. I think at the moment, we've got 27% of surgeons in this country who are consultants are female. But what I could influence was the makeup of the core surgery training group that I chaired, and that's the picture below. So, but you have to be in the conversation to change the conversation. This is an interesting photo. So the photo here on this side, these 2, we met at the college, we just bumped into each other. These 2 were my housemen when I was in Cardiff. This was the SHO. I was at that point the other SHO, so we worked together, and this was our senior registrar at the time. But what really struck us, which is why we took the photo, was the pale and stale College of Examiners that stood behind us. The Royal College of Surgeons does not look like that now. It has changed, and it has changed because we have influence. Picture at the top, so I was on council. I've just emitted, I was on the Royal College of Surgeons council for 8 years, and the council has changed. It is diverse. It is diverse in gender, in race, in belief, in age. But it is because you are in the conversation and you can change it. So, life. Life was interesting. So my legacy, obviously, are going to be my 2 children. So I got married, we celebrated our 30th anniversary this year. Parents are now gone, but their legacy, thank you. My husband says he deserves a medal because he would have got less for if he'd killed someone. So anyway, so it's always this conversation. Mum and Dad have both passed, but their legacy lives on. And I really feel that memories are important. They're like footprints in the sand when people go. You know, the footprints wash away, but what's in your heart stays. And their legacy in me is the legacy that I want to now make sure that passes on. The reason I've got the star is because I've got 2 children. Now, I was the first Calman trainee in Wales that was female. I was definitely the first to have a child, and I remember having to tell my boss that I was pregnant and didn't know how to tell them. But I took 12 weeks off for both my pregnancies because it was not the done thing for a female surgeon to have children. I can promise you, any female trainee that has gone through my hands who is pregnant, I have talked to them and I have encouraged them, almost made them stop doing on-call at 35 weeks and actually take 6 to 12 months off as mat leave. I had preeclampsia with my first, and I was in labour when my bosses came in to see me at Clondalk in Cardiff. And second time round, I delivered the day before I stopped working, went to see my boss 3 weeks afterwards, who was Professor Dormandy, because I was doing my research degree, and we were writing a book, and he asked me to finish my book on my maternity leave, which I did. That is not what my trainees will ever do, unless they want to. So it's important. And listen, I'm one of many, so please don't clap, because I'm one of many. There are so many stories of people who are doing things so brilliantly that I feel humbled, so please. And the photo in the middle is my 2 children. So the first time this year, my husband had heebie-jeebies because we had my 2 children and their 2 girlfriends on holiday, and I can tell you, he didn't enjoy it at all. But there's a shout out for my sister and for my husband, because without their support, especially my sister, without their support, I definitely would not be here. Because she's been a surrogate mum to my 2 children, and she has been at my side. And your families are so important, and we must remember them. But life goes, so I always feel like I'm a bit of a swan, so on the surface, everything looks like it's fine. Underneath, the legs are going at 100 miles an hour. And life hits you sometimes. So that's my MRI scan from 7 years ago now. I was getting unbalanced as I walked, I got tired. My handwriting, which Daddy used to make us write a page of handwriting every day, so it's beautiful, became quite Parkinsonism and quite scrawly, and I had an acoustic neuroma and had 6 months off work and became a patient. And it is humbling to be on the other side of what we give as caregivers. And it reminded me of the care that we should be expecting every single day. Every single day we should be aspiring to excellence. And each of you, again, will make a difference. So, thank you, Danielle. You talked about the Croydon Elective Centre. We were in the paper because we'd done that. There was a quote from myself, and suddenly I got tagged on Twitter by someone who's the Professor of Communications at Swansea University, and said, Ms. Big, it'd be good for you just to hear this podcast. So anyway, so I listened, and he had read, so this was BBC Wales, and they were talking about the Sunday papers and what they had noted in the Sunday papers. And he talked about when he was in hospital in 1991, when I was a houseman. He said, I read it and this name jumped out on the page, and I remembered it was the houseman on the ward when I had my operation who took time out to come and sit with me when I was really anxious at 2 o'clock in the morning and listened to what I said and made sure I was comfortable. So 1991 to 2022, this gentleman had remembered my name and remembered what I had done. So your everyday acts of authenticity are what people remember. Don't try and be someone else, because you can't be. It's not authentic. It doesn't hit home. But we come now to where we are now. So I just want to take you to the graph in the middle, all right? Because everything that is going on has happened before. So in any kind of trauma, and we've had COVID, what we have is that pre-warning, pre-disaster, everyone starts to come together. I mean, Croydon had never been so cohesive as that time that was COVID. We were on WhatsApp groups together, everybody was talking to each other, everyone gave discretionary effort, and then we have the disillusionment, and we go into a phase of reconstruction. And many of the things that you see now are because of that. And our job, yesterday, Jax, you talked about hope. Many people talked about hope. We don't need to hope. We need to ensure that hope exists, and we need to make sure that we get back to normal and better as we go forward. And there are lots of things that if we think back to COVID, what did we do that made a difference? Well, the things on this side, which is a grassroots innovation all the way through to money, and the permission to get on, and I love the conversation of don't ask for permission, ask for forgiveness. I do pilots in lots and lots of things because it means I never have to ask for permission. But we've got new capacity. There has been funding that's come in. Now our job is to do things that are slightly different and actually really transform the NHS. So you heard all this yesterday. You know, Darcy, Keir, Wes are all saying the same thing. The NHS is here to stay, but the NHS is not going to look like what it is today as we go forward. It has to look different. And I just want to take you through just a snapshot of the kind of things that we're looking at. So this is the gynecological waiting list. 51% of our population are women. We've done really well. So as we went into COVID, we had 300,000 women on the waiting list waiting to be treated. We now have 600,000. But you know what? We've had 600,000 on that wait list since last year. Different 600,000, but it's plateaued. So the demand and capacity that we have, we're not making a difference now. And these are people who are of working age, and I can put any speciality you want on the board, and it will look the same. We need to do things differently. For women's health, we need to have women's health centres. We need directed tests. If you've got postmenopausal bleeding, why do you need to go and see your general practitioner? Why can't you go straight to a community diagnostic centre, be triaged, assessed, and then be forwarded to the right person who can look after you? Because the majority of that is going to be HRT related, and actually doesn't need a secondary care intervention. We also challenged your conversation, there we are, challenged your conversation yesterday was absolutely to the point. There is no primary care and secondary care and community. It is a continuum of care. And Chad was absolutely right yesterday saying, our public don't recognise the differences. They just want to see someone who will help them, and they want to get back to work. So we do have to have curiosity, and we do need to do things differently. And the reason I've got a stack of shelves with empty scrubs is it doesn't matter how much you talk about theatre productivity, unless everyone has skin in the game. I went to the Cleveland Clinic last Monday, and they call everyone caregivers. Everyone is a caregiver. It doesn't matter whether you're an admin or you're a domestic, everyone is a caregiver. If those scrubs are not delivered in time, in the right process, you will not get your theatre list started on time. Two things will happen. You'll either cancel a case, or you ask your team who work with you and are so loyal to stay on extra. But they've got a work-life balance, they've got to pay their childcare, they've got other things to do after work. And the value and respect is to make sure you start on time and you finish on time. But that means you have to map out the entire process. Oh my God, there is so much waste in the system. I'm going to let you read what's on the board, but I'm just going to take you to two things. One is what's at the very bottom. So the entire waiting list at the minute is about 6.5 million people, 7.5 million things that need to be fixed and sorted. But there's a lot we don't count. If every consultant saw one extra patient in their clinic, we'd see somewhere between 3.5 and 4.5 million extra patients in secondary care. We'd solve the problem overnight. Can't all do it. My clinics are overbooked on a Monday morning. If anyone puts an extra patient in, I will kill them. But that's why you've got the range of 3.5 to 4.5. But actually, if you looked at missed appointments, which currently are labelled as DNAs, did not attend, meaning the patient's at fault, 50% of those are because our processes are not right. Chand, I think you yesterday said in primary care about 27%? 20%?
27%.
27% of GP appointments follow the same kind of trend. But what's the other 50%? It's patients who can't attend because they can't afford to come. Okay, they've got no childcare, they're on 0-hour contracts. You've given them an appointment at 10 o'clock in the morning and they have mental health needs, they are on medication, which means they cannot get up in the morning. And when they start to function, it's about 3 o'clock in the afternoon. We worsen health inequalities by what we do. And Patient Voices said a long time ago, if the NHS ensured that it was fit for purpose for the Romani community, you will get it right for everyone. We need to rethink how the NHS is set. This is me, still a swan, my legs are still kicking, but I love being a mother, I love being someone who's confident, I love being a friend, an ally, mentor, supporter. It's where my positive energy comes from. And it is amazing, and you make a difference. So I'll tell you about the pictures up there in a second, but I want to tell you 3 quick stories. The first is, because you touch people, so I was trying to count up yesterday how many trainees have gone through my hands. So I was 10 years as Foundation Programme Director, I spent 12 years as Core Surgery Training Programme Director for South London, Higher Surgery Training Director, I think almost 10 years again. I mean, there have been thousands and thousands of trainees who've gone through my hands. And they're still friends on Facebook, on Instagram, and they regularly update me as I go through, and the positive energy comes. But I'm just going to talk to you about 3 of them. One is a male trainee who is a Peckham boy from the Peckham estate, and he is honest and said, he was my F2, and he said, you know, Miss Vig, all my friends are either in jail, dead, or doing drugs. I'm the one that got out. I'm the one that's made a difference. Well, he was given to me as an F2, as a troubled trainee to look after. And he had made a mistake before he went to med school. He did something on behalf of someone else, fingerprints were taken, and used the wrong name. Well, it came out as he was first year where the person that he had helped then was involved in criminal acts. So when they looked at fingerprints, realised the fingerprints didn't belong to him, and my trainee got himself into trouble. He doesn't have money, he's not that kind of individual. So he represented himself to the MTPS within the GMC, not within the GMC, but represented himself, and was at the point of being struck off. And I went into the panel and said, we now need to decide what message you are giving. The message you are giving to the Peckham community is it doesn't matter how hard you work, doesn't matter how remorseful you are, doesn't matter what you have done afterwards, but a single mistake means that your career is over. Or you can send the message that actually our backgrounds are important, that we have to invest in the people that we work with. Now, That wonderful, wonderful trainee is now a GP trainer and is an incredible force of nature. You make a difference to the people that you touch. The second story is, I don't know if anyone in the room knows Imran Qureshi or Agatha Northley-Mesh. They were my first foundation trainees back in 2005. They are now, I mean, I'm hanging on to their coattails, but they're amazing. Yeah, no, absolutely amazing. But again, a force of nature. But they started quality improvement under my care back in 2005. The people you touch, you make a difference. The last story, and there are hundreds, the last story is one of my trainees again, who I supported back in, my gosh, 2006, 2007, is now very senior in the health community in Malaysia, and reached out to me 6 weeks ago, and we're now going to do some collaborative work. You make a difference to the people you work for, but actually they come back and they support you in what you want to do as well. So remember the difference you make, but it's the authentic you that makes the difference. And the reason I've got these pictures here is, I don't know how it started, but it became a tradition that I think the resident doctors now, so my juniors, made me cakes for my birthday. I don't know quite how it started, and it got more and more competitive as the years went on. So the cake at the top, and the cake that you can see is in a posh London restaurant, where my juniors brought out a cake of an amputated foot with maggots. I can tell you, as it came through, you could see everyone gagging. And the maggots are gummy teeth, sweet gummy teeth, cut away, so they look like maggot, honestly. And there was even a tea bag, you know, these posh tea bags, out of which, because it was like maggot larvae, honestly, it was dreadful. And the other cake is an aortic aneurysm with accessory renal veins. I thought they were amazing. But honestly, the positive energy from my trainees is fantastic. This, like Tanvir talked about earlier, always makes me stop. I try and include it in every single one of my talks because I feel so responsible. I was awarded the Dr. Rose Polgi Award in 2018. Tanvir, like you, she will stay with me forever. I never met her. She was a young doctor in Brighton. She also took her life. This should not be happening. And the Doctors in Distress conversations are phenomenal. But we do need to be asking the questions. You need to be saying, how are you? You need to check in with each other, but you need to listen with intent when you hear the answers. And often just follow it up with a conversation. We should not be losing good people because of this. But I had a conversation yesterday which was really helpful, which also said, you can't be responsible for everything that happens. And I think that's also important. But your intent is what is really important. So I'm going to come to an end shortly, and you know, this is my father. So Daddy was born in 1925, he died when he was 92. He says when he started at school, there were chalkboards, and he used to do his studies by an oil lamp. By the time he died, he was using WhatsApp and computers, and he was, and on home oxygen, taught my children how to use a shisha pipe. Which I came home one day, and Arjun, we'd gone to Turkey, and Arjun had bought a shisha pipe, and I sort of put it away, saying, I don't know how to use it, so you can't use it. So I literally put it in a cupboard and put it away. Came home, Daddy on home oxygen, and both kids with Daddy using the shisha pipe. It was incredible. But he's left a legacy. But his life and my life is not going to be the life of our trainees going forward. So if you get an opportunity, read the book, The 100-Year Life. Our lives very much, so I'm now 57, our lives are very much in 3 stages. A third in education, a third in work, and a third in retirement. The colleagues that we work with now are not going to live like that. So my children, who are 27 and 28, are likely to live over 100. My goddaughter, who's now 3, is likely to live to 112. Their lives are going to be very, very different. Think about it. Think how that impacts on our everyday, but also how that impacts on the people that we serve as who are our patients. So, as life comes to a close, my little drop in the ocean is important for me. I expect to leave a legacy. But my question to all of you, and it's not a question actually, what I would like you to do is I want you to turn around to whoever is on your table and I want you to say that you can be the change. Because each of you have influence. I want you to do the affirmation.
Can be the change. Can be the change.
Jag, can we do it?
Yes, I can.
So,